If I asked the average guy on the street to think of some diseases that men suffer from, there's probably one that wouldn't get a lot of attention. And that's probably because the younger guys never think about it, and the older guys are too embarrassed to talk about it.
Of course, we're talking about your prostate. This is a walnut-sized organ wrapped around your urethra where it leaves the bladder. If it grows too big, it starts to interfere with the flow of urine out of your bladder and you start getting symptoms. Believe it or not, over 40% of 40-year-olds will have some benign enlargement of their prostate, and as many as 80% of 80-year-olds will show evidence of prostate cancer on autopsy. These are huge numbers.
Let me show you a quick questionnaire of what doctors use to ask our patients to figure out whether they're suffering from an enlarged prostate.
Do you feel like you still need to urinate even after you've just left the bathroom? Do you find yourself looking for a bathroom and it's only been a couple hours since the last time you went? Are you having to stop and start several times before you're done? Do you find when you gotta go now? Do you find you're more of a creek than the river you used to be? Do you need to push hard or strain to get your urine going in the first place? Finally, are you having to get up at night to go to the bathroom several times?
So how'd you score? Well, if you scored well and you're like most men, you'll just forget about it and not worry about prevention. And if you scored poorly, you've probably already seen your doctor.
So what approach do most doctors have? First of all, the possibility of cancer needs to be ruled out. Cancer is different from benign prostatic hypertrophy or an enlarged prostate. There are a number of tests that can distinguish between the two. So if it turns out we have good fortune and it's not cancer, just an enlarged prostate, what can your doctor recommend? You may be told to do nothing for the moment until symptoms get worse. You may be given a prescription for a drug to shrink your prostate. Or if symptoms are bad enough, you may undergo surgery.
What about natural approaches?
Well, hands down, the most recommended natural supplement for prostate enlargement is saw palmetto. There are hundreds of clinical studies examining the usefulness of saw palmetto on benign prostate enlargement. In fact, in many European countries, saw palmetto is routinely recommended by doctors.
Well, how exactly does saw palmetto work?
It blocks an enzyme that promotes prostate growth. This is exactly the same mechanism that common drugs like Proscar and Avodart use. The criticism faced by natural products in general is that they're impossible to manufacture to the exacting standards of a drug. So much can be affected by growing season, plant type, genetics, and so on.
So it's critical to be critical about which natural products you're going to use. This applies to saw palmetto as well. Let's go take a little ride to see David Pelletier, who is the Quality Assurance Director at IMMUNOTEC. Come on.
Here we are outside of one of IMMUNOTEC's buildings. This is where we manufacture and package many of our IMMUNOTEC products. We're going to go inside and speak to David Pelletier.
Okay, David, thank you very much for letting me visit today. I'm very excited.
A real pleasure, Dr. Gutman.
Let's go see the plant.
Of course, Dr. Gutman. However, you will have to be wearing this.
What's this? Oh, do I have to wear this?
Of course you have. IMMUNOTEC has this pharmaceutical grade plant, and it's really important to follow rigorous control, so you gotta wear this.
It's a deal.
Not an option.
Let's go.
Perfect.
David is going to show us how Magistral is made. David, how do we start the process?
Everything starts here.
Wow, what's that?
Saw palmetto berry.
Those are the actual berries.
Absolutely.
Well, I thought most places will have like an extract or the powder. Why are we using the berries?
We start from the berries and we grind them and we extract the active ingredient from here in this plant here. We have IMMUNOTEC has developed an exclusive manufacturing process to generate its own concentrate of saw palmetto berry.
Well, that's as close to nature as you can get. David, we're standing next to this huge tank. What's inside of it?
This is 25,000 liters of natural spring water. We only use spring water because we want to make sure that all of our ingredients are top quality, including the water.
So, David, thank you very much for the tour today. I'm sure that the IMMUNOTEC distributors are going to get a great kick out of this.
You can come back anytime you want and do more video.
Thanks again, David. I think it's fair to say that most people watching this video would prefer to use the natural approach. Now, I've written for thousands and thousands of prescriptions for pharmaceutical products, but given the option, I think this is the best way to go. However, there are a few things that I have to emphasize. Just because something is natural doesn't mean that it's safe. Cocaine is natural. Arsenic is natural. And even if it's safe, it doesn't mean that the product you've just laid your hard-earned money for is going to work. Far too many products are either not properly prepared, don't contain what they claim to contain, or are otherwise not quality controlled or tested. Remember, before you put anything into your mouth, make sure that the research is there and that there are quality assurance, obsessive levels to guarantee its content. Until next time, to health.
IMMUNOTEC'S Magistral, a unique and proprietary blend of 5 natural substances: saw palmetto berry juice, ginseng, ginkgo, damiana, and muarapuama. Magistral is used for prostate health and for sexual health and vitality.